So today we will hear again from Jesus Enriquez, who is the Outreach and Information Specialist at AgeOptions. AgeOptions is a statewide area agency that provides referrals and support to older adults over the age of 60 who reside within Cook County and Cook County Suburbs. So Jesus will present to us today on the topic of Senior Medicare Patrol, also known as SMP, and he educates older adults about healthcare benefits and empowers them to protect themselves against healthcare fraud. So we will discuss how each of us as participants can either prevent fraud as community leaders and how we can efficiently communicate that same message to those that we serve. Jesus comes with a wealth of knowledge and experience from serving in AgeOptions as an outreach and information specialist. His background includes working in nonprofit, community health, adult education, and community outreach. Jesus was an Affordable Care Act navigator at the Alliance for Multicultural Community Services in Houston, Texas, where he did community outreach and assisted people with enrolling in the Affordable Care Act insurance. Jesus has also been a health navigator and a health promotion outreach associate at Erie Family Health Center, where he helped uninsured and underinsured patients research health topics and stay connected to community resources. He also manages referrals, connected patients to scheduling, and represented Erie at health fairs and events throughout Chicago. His role currently is to provide outreach, support, monitoring of data for the Senior Medicare Patrol program. He also provides these programs in Spanish. So without any further wait, let's give a nice virtual welcome to our presenter, Jesus Enriquez.
Thank you, General. That was one of the best introductions in a very long time. So I gotta give it to you. Thank you so much. Thank you so much, everybody, for donating this wonderful time of the day, which the sun is up. So we are a little more cheerful, like spring is coming. And my name is Jesus, like General mentioned. This program has been in Illinois for 26 years. So it's quite a long time since this program has been implemented. And when I go in the community, people, I mention this to people and people say, oh, I didn't even know this existed. I didn't even know I can report this somehow, like without calling 1-800-Medicare, which you can, of course, or I didn't even know this scam existed. So we want to be talking about the types of scams. We want to be talking about a lot of helpful numbers to report problems, including consumer fraud. And one of the ones that's important to you and to me is identity theft. That is a big problem. But before we do that, wherever you see this logo, it's us. So we do have federal funding to do our program, so that allows us to go out in the community, provide a free service, provide resources that are completely free to you to use and share in the community. And it's just funded federally by the Administration for Community Living. So the Administration of Aging was part of the senior agency in the whole United States. So the Administration for Community Living merged aging with disability in only one. So SMP is also managed by AgeOptions. AgeOptions is a nonprofit social agency. And to do this collaboration, though, we need 11 state agencies. So each state agency gets an area, what we call service area, but they are supposed to serve seniors from those areas, like Macomb, like Egypt, like Carriel, like Chambord, like different areas. Each one is responsible one. So we
Did you know Medicare is
and here we have
under attack from fraudsters, scammers, and con artists?
This is for real?
I can't believe it.
Just how big is Medicare fraud? How about a $60 billion crime that we all pay for?
That's what makes it so incredible.
What can I do?
For starters, you can turn to the Illinois Senior Medicare Patrol. SMP will show you ways to spot and report Medicare fraud.
You're a fraud.
It's fraud.
What next?
When you call SMP, you can help shut down Medicare fraudsters and bring them to justice.
That's the plan. Amazing.
It's up to you.
Fight fraud. Contact the SMP at 1-800-699.
And that's one of the ads that we had on TV. I know it's a little funny, but serious at the same time. We always emphasize the importance of reporting fraud, letting somebody know, at least somebody that's qualified about this problem. This is one of the ads in 2022. However, in 2023, we have a new ad, and that ad is displaying in the major networks and TV and waiting rooms as well. So it's a very intensive campaign that we're doing because it's spreading everywhere, the fraud, as you know, in different areas. And our partners in different areas in the state are also doing some special projects in buses, highways, billboards, things like that, because it's a constant outreach campaign, outreach method that we have to follow. Now, one question that I have to make everybody here is, have you ever been a victim or heard anybody being a victim of any kind of fraud? Medicare, consumer, anything related, or have received any suspicious call? Anyone want to chime in and participate? One of these three questions.
Hello, this is
Yes.
Stephanie. I have one. I'll give you one. Yeah, I have started getting phone calls about, we understand you're going to be new to Medicare, and one of the callers actually says, I'm calling from the Medicare health plan.
Wow.
And I have said, I know you're not with Medicare because Medicare does not call people. And of course, they don't like to hear that. But yes, that was a very suspicious phone call. So yes to that first question.
Thank you, Stephanie. No, definitely there's something new that because of data breaches, because of your information exposed online, even if you're on the computer, you become a victim of these techniques. So Harriet, you have your hands up? Harriet.
Let me come off mute. Yes. And some of it is my personal background, but we have the brace ready for you. We have the information to send you the brace. And I know that I didn't order a brace.
Okay.
And also, I had a pedorthic facility. And so when I went into the at a senior center and saw on the elevator free choose from Medicare for diabetics, my blood would boil.
Wow.
I think it's an important feature and absolutely essential. But I'd like to see a little more management of it.
Absolutely, absolutely. So you believe a lot of senior centers, public places do commit this kind of scheme. So I will give you the number. The number will be in the end of the slide. And all I'm asking you, Harriet, is to leave a message. And we'll get back to you on this. We will work back and forth proactively with you. Just to get
yeah.
Go ahead. Yeah, go ahead. I'm sorry.
So I leave a message, and then when they call back, I'm concerned about scams and answering my phone.
We will say it's Illinois SMP. So we'll say it's Illinois SMP. We'll say it's us from AgeOptions. So you always hear we are from AgeOptions. So
okay,
we are fully 100%. I understand the concerns, of course, but we are here to help. So
thank
that's
you.
what I want you to know. So thank you for that. So yeah, in some presentations, we get people popping up and saying, okay, no, you know what, this happened to me. So Harriet, thank you so much. Anybody else has any comments before we move on with the slide?
Okay. Well, I noticed I'm now 85, and so I don't get so many calls anymore. But when I first turned 65, they really, they inundate you with calls. Oh my
God, yes.
And the pitch back then was, we can help you. You're entitled to all these benefits and we can help you get them. And you know, my wheelchair was waiting and so on and so forth. And quite apart from the fraud, I don't like the fact that it's encouraging people who are quite able to get around to take advantages of devices that they don't need. I mean, this is not doing them any favors. It's not, quite apart from the fraud, it's not helping them stay active and healthy.
Correct. Correct. No, that's basically upscaling. They are trying to give you something that you should get diagnosed for. And I know what you're saying. They have different strategies to just get it covered. And that's one of the main concerns I share, Suzanne. People shouldn't use these services. You don't need it. Because in the future, if you need it, then you won't get it covered. So yeah, that's highly concerning. So thank you, Suzanne, for that comment. So without further ado, we are moving to the next slide over here. This is how we prevent Medicare fraud. We don't want this happening to you. And we do this by doing the following things. Educating yourselves on fraud. So you have to know what's going on, right? Because Suzanne, for example, you mentioned the wheelchairs going on, like the scams going on. You mentioned diabetes supplies going on. That's another one. We know the knee braces, but I'll show you other scams in a minute. When we are moving forward with all of them, I'll show you. There's other ones that are a little more scary. I don't mean to be really negative about this, but we have to be more realistic here. So before I move to that, only sharing your Medicare number with your provider. Anybody else should have access to it. If you get that call from somebody saying, I'm from your doctor's office, can you please provide your number again? That's a red flag, because they should have it listed on their system. So that's one very common one right there. Also, make sure you get a medical summary. You know that sheet of paper, the sheet of paper that you get after your doctor's visits? Don't toss it away. Put it somewhere. Put it in a folder. Check this out with your Medicare bill, because sometimes things don't make sense or they don't match. Now, when we have events in physically, we provide personal healthcare journals. Those are free things funded by the government. They are booklets where you can write doctor's appointments, and they are fully in color. So if we ever come to you in person, we can provide some of them. But if you don't have one of them, I advise to get a notepad, to get a booklet or something that you can write what you're doing with the doctor, because you also want to know what's going on and while you're getting done at the doctor's office too. And check and ask questions to somebody that knows a problem, right? Because sometimes we might ask somebody that might not be trusty, right? Not be trustworthy, or it might not be a social agency, or it might not be somebody who's a social worker, or somebody who's not a care manager. And it might be somebody, might be your friend, right? Which is fine. But sometimes those friends might not have the right amount of information. So with that in mind, so if you call our tip line, our number, and that's a silly question, even if it's a silly question, we can still answer it or try to answer it or steer you out. A lot of times we get calls when somebody wants to know how to prevent consumer fraud and what do they need, how do they need to get the credit report. So things like that. There's no silly questions. So why do you have to prevent Medicare fraud? Like you saw in the ad, $60 billion in average every year are lost through Medicare fraud. 60 billions. So what can you do with 60 billions for the government? A lot of things can be done with government, like maintaining the Medicare program for more years. That's one of them. But there's also a risk that basically your benefits could be used up. And when you need them, they might not be there because you already utilized them. And a lot of times happens, you give your number away, you don't get anything back. Medicare pays for it. And then you need equipment. Let's say you need a back brace. And the doctor says, you need a back brace, I'll send you the prescription. And you get it done. But then you're like, what happened? I never received it. It's because of that too. You already used it with a scammer, but you don't remember when. So that's why reading the Medicare bills will give you a picture of what happened in the past with your Medicare. You might end up having to pay out of pocket. If Medicare says, nope, I'm not gonna cover it, then you might be responsible to pay the full price, for example. This is just an example. Now, these are the types of scams that are happening. Harriet mentioned like one of them, like back brace. That's durable medical equipment. We've seen those scams for decades. I guess since the 90s or 2000s, they always been there. We have the genetic testing scams, where I want to explain about that in a minute. The new Medicare card scams do exist still, no matter what. Home health fraud. There's another one that I want to add right there. It's the catheter scams. And I want to add something else there, the COVID-19 testing kit scam. So I'm going to talk about those when I finish those. These ones right here. So walkers, back braces are just examples of durable medical equipment. And you are asking, why do they call it durable? Because they're supposed to last for quite some time, several years. Don't give your Medicare number to somebody you don't know. And usually these people contact you over the phone. A lot of times, I want to say 90% of the time, it's through the phone line. So like you mentioned, nothing is really free because it has layers of screening, it has paperwork, and a lot of times your Medicare plan might say, oh, you have to pay $5. You may have to pay $10. So nothing is really like they say it's free. Oh, if it's free, that's nice, but not really. And talk to your doctor if you need equipment. So always make sure you get the diagnosis, right? You need a diagnosis, you need the analysis, you need the screening, and then paperwork. So it's quite a process. Now, the genetic testing, you probably didn't hear about it, but it was in the media a couple years, 3 years ago now at this point, but still affecting people. It involves the use of saliva, as your DNA is in your saliva, and involves the use of the cheek swab, and involves the use of your Medicare number. So the newest one is somebody calls and says, oh, you know what? Your cardiologist told me that you need a genetic testing done because your health can get worse, for example, but I need your Medicare number to send you a cheek swab kit to your house. So you get your saliva and the cheek swab, put it back in the mail and send it to me. But as a result of this, you don't get anything back. You get a bill for $10,000, $15,000 in different charges. How many charges? Up to 20 or 30 charges in your Medicare bill. Obviously, if you see a hefty Medicare bill, you want to open the envelope, right? And you want to look at it and say, no, this is not me. So anything that says genetic, molecular, anything that says genetic, like of that matter, then it's a red flag. So here, this is a quick thing for you. Genetic testing is not covered in any insurance. None. You have to pay out of pocket yourself. It's like $2,000 to $5,000 to do a genetic screening. So it's not really like it's gonna be free for all. And another way, though, I don't know if you remember this, telemedicine is popular during COVID emergency period. Still is able to use, but you might find some scammers trying to roll you in through a phone call or telling you, oh, we can go in a video chat and I can make easier for you. Say no to that. However, though, if you need a telemedicine with your doctor, ask for it. They'll still provide that. Sometimes you might not have to go to the doctor's office. Still covered through Medicare, though. The next one here is, so the new Medicare card scam. Maybe somebody of you get a phone call, you get people saying that they got it. They are offering you a new car made out of gold. I don't think they can make something out of gold. It's too expensive, but that's what they are saying. They are saying that you can use this to prevent Medicare identity theft. It's made up with a chip, a smart chip too. Obviously, You don't have to do anything, nothing at this moment to replace your car. The only thing that I advise you to do is if you lose it, you call 1-800-Medicare and you get a new replacement or you get a new number. Remember those times when you cannot get a new number? Well, those times are gone. So now for your own protection, if you lose it, if you don't know what it is, you can get a new number for free. You just call 1-800-Medicare. So that's the new Medicare card scam. And the home health fraud, that's one of them that's really, really old since the 80s, 1985, 1987. So these people are trying to be your housekeepers, your laundry washers, your window cleaners, what have you, anything that you need to get on your house. But they need your Medicare number to do those services. So if you're smart like anybody else here in this call, you're not going to give the number away because you know home health care, you need a chronic condition qualifying in Medicare and your doctor to get you those hours. So home health at home is partial. It's not 24/7, unfortunately. There's many restrictions, that's what I'm trying to say. And it's not always free. Oh, before I jump in financial exploitation here, the last scam that we have right now is the COVID-19 testing kits, boxes. Those are not the ones gotten by the government. Those are the ones when somebody all of a sudden sends you these boxes and they end up in your mailbox and you don't know how you order them. You don't even know, you don't even contact anyone. So in order to check if those exist is look at your Medicare bills for curiosity and see if something says COVID-19 cheek swab or COVID-19 test kit and look for charges of $96 or something like that. Because if you get those charges, they might be questionable. When are those years that we have to look for? 2020, 2021. So in other words, if you have a COVID-19 testing kit, if you need it now, you need to talk to your doctor. It's not available through the pharmacy like it used to be, unfortunately. You're still covered though, but you need a doctor's prescription. Lesson of the story, you don't have to pay for that if it's prescribed. So don't accept anything from anybody asking you for your Medicare number, giving you a testing kit. But the government, though, in COVID-19.gov, you can get free boxes. I believe so still. You can get some of those free new boxes for free, but they don't ask for insurance, though. They don't. They just ask for your mailing address and your name. That's it, because that's for the government. Now, the other one that we have is the catheter scam. You say, wait a second, what do you mean catheter scam? Yes, catheter scam. So this scam works like this. Somebody calls and says, okay, you know what? I'm calling in behalf of Medicare. You can get free catheters for personal use. All I need is your Medicare number and they're free. You can just get them for free, no questions asked. So just give me your number. So we got in calls from people that have to pay between $15,000 to $19,000 in 10 charges through the course of a year. So it's getting traction here in the state, in Illinois, Michigan, Wisconsin, they have some cases. So lesson of the story, if you get one of those calls of somebody asking you for a catheter, say no. But also, even if you don't ask for it, you're still getting those Medicare bills. So open your Medicare bill, look for catheter on there. And if you get one that says catheter and you never needed it, then that's a red flag, okay? So just look in the months before just to make sure there's nothing questionable. So I'm gonna go really quickly in this section because this is, I'll have this for you to be shared as a reference. Financial exploitation means the use of an adult 60 years over or 18 to 59 years old with a disability in advantage of the person taking care of that individual. So there's still money from them. They misuse credit card. They use resources not the adequate way. So they don't pay bills when obviously there's money, but the money was somewhere else. So withholding money is very typical. So for that, there's different hotlines available, different things that they can do to report the problem. The state of Illinois has a 24-hour hotline where you can report suspicion of financial exploitation. And that's the number right there. We'll share the slides with you all. They have the Adult Protective Services in Cook County. This can help you find the agency that can help you complete a report. And the if it happens in a nursing home, it's the ombudsman program. If the financial abuse happens in a nursing home, Suburban Cook and City of Evanston have the respectful numbers. And this is the definition of a scam. Fraudsters get information from you in exchange of cash, or getting financial advantage from you. The Social Security, the IRS, the identity theft, the enrollment scams, the grandparent scams, and I'm gonna add one, the artificial intelligence scams too. When they use your voice or somebody else's voice to get money from you. This is how you avoid a scam, knowing that those agencies will never call you out of the blue. And somebody mentioned Medicare doesn't call, you're right. They send you a letter if they want something from you, and that letter has a logo from the government. So learn the logos from the government because it's also helpful to know how they look like. So the IRS never call you to any enforcement, right? They might send you a letter telling you you are being audited, but they will give you a chance. They'll give you time. They'll give you payment plans if that's necessary. So never give out your information. You know those secret answers to questions? Like, what's your mother's maiden name? What's your city where you were born, for example? Don't give that away because even if you don't have your social, they can steal your identity with those answers. And it's kind of scary how they do it. People have better ways. These are the numbers I'll be sharing with you through the PowerPoint. How to report one of each of these problems. One I want to highlight for you is to Equifax, Experian, and TransUnion. Every time you call that number, you can report identity theft, but also you can request a credit report of each one of them. Why would you want to look at that? To make sure there's no charges in your behalf. And another thing that I have good news for you, if you're not getting a house, if you're not getting a vehicle, right now, you can go and freeze your credit. Some credit card companies do offer the option to freeze your credit. And why would you do that? So even if they steal your Social Security, they cannot use it. They can't. So I froze my account. My accounts are frozen. I go in my credit card website and I click on freeze whenever I need to do something. So yeah, that's free. That's not a big deal doing that. It will protect you big time. Then the Identity Theft Information Specialist, the Elder Fraud Hotline, National Line, the U.S. Senate Special Committee Agent in Fraud Hotline too. So there's numbers I'll be sharing with you. And this is one that I want to share with you here, the IllinoisSMP.org. IllinoisSMP.org, one word. I'm going to do a share here, and I'm going to show you how the page looks like. Just 1 second here. Okay, let's do this again. Okay. Okay, let me put it here since there's so many windows. Let me try here. Okay. So when you do IllinoisSMP.org, that's our website. This is how it looks like. You scroll down here. You see all the description of what we are, our program, and you have the tip sheets right here, okay? So those tip sheets you can click and print. They are free to use for everybody to share. I have new ones that I'm gonna share with you. One of the catheter and one the COVID testing kit stuff too. I'm gonna share with Jeno soon. Those are newly released ones, but this is what I want you to pay attention. Fraud alerts. Fraud alerts are reports like news that happen in the United States about new scams. So I click in here, in this button right here, you can sign up. And I put my email address, any email address that you want to subscribe to. You don't have to put any names. Just put your email here, right here. Put your email and sign up. And it will sign you out automatically. How often are you receiving these updates? You're receiving these updates every other week. So basically bi-weekly, you're receiving these news. So let's move to the next slide. So we are always looking for, oh yes, I can place the link. Yeah, you're right. I'm gonna place the link. Good idea. So we are always looking for volunteers to conduct events. And we really appreciate the opportunity that volunteers do for us. Again, it's very important that disseminate the message, but volunteers get dedicated time where they can do activities like education programs. They can do bingo because we have bingo to play with everyone. And we have also helpers that way we can do a table and share information about our program. So in order to do that, you can contact marina.silva@ageoptions.org or at hotline 1-800-699-9043. So this number, write it down, the 1-800-699-9043. If you have something to report, that's the number we usually leave a message. And we'll respond to that message. But I'm gonna have it here in the end so you can see it in bigger letters. So I'm gonna have it here. I'm gonna have it right here, see? So the 1-800-699-9043. When you call that number, our receptionist answers the phone for you. And what department you wanna go, you say SMP. Just say SMP. Our phone call goes to our voicemail SMP system. You say your name, your phone number, and just what's happening, and we'll call you back. Any comments or questions at this point? Thank you, Jeno. That's that's helpful. I wasn't thinking about copying it there. That's good advice. That was great. Any comments or questions?
problem.
I have a question for like our neighbors in Indiana or Wisconsin. I'm obviously not
Oh,
Illinois,
yeah.
but would most of this apply, or is AgeOptions only an
there's a
Illinois
page.
organization?
There's a page. Let me give you the link right now. So this is a national program. So let me give you the one here. This is a national program. So thank you for asking. This is national too. Jeno, how dare me? I forgot to say it was national too. I'm sorry. I'm just teasing here. So every state has a chapter. So you go smpresource.org, you click on find help in your state, and it will take you to the local number. So thank you. Any comments, questions, concerns? There's a lot of scans going on, right? Jeno is moving her head.
Yeah, I'm sorry. I thought I was off mute, but yes, that's it's unfortunate. That's the best word I can use, that people go to such extremes to manipulate people. But it is also fortunate to know that we have you all, who are on top of those things and can educate the community. But yeah, now I'm going to now ask my mom, hey, we got any of these type of calls? So, thank you so much, Jesus.
Anybody else has any comments or questions? Harriet? You're muted, Harriet.
Oh, Harriet? Mhm.
Can you distinguish between financial exploitation and fraud? Because my remark about the diabetic shoes for people with diabetes, it's really valuable, important program, but not, it's easily exploited.
Financial exploitation has to do with seniors per se, with the individual recipient that is taken care of, and the provider directly, like one-on-one case.
So if we had any question, we should just call in and say, I don't know if it's exploitation or fraud, and let SMP follow up.
Yeah,
Okay,
yeah, because sometimes, so what we do is we do direct people to the HHS OIG hotline. They have a national line. And sometimes the HHS has to investigate in a group setting, like when there's more people in, not only one beneficiary, you know what I mean, Harriet? That it's a larger scale issue. And the OIG don't take all the cases though. They don't take all the cases though, because they get so many calls, but they do. I mean, there's a chance they might take it depending how severe it is.
yeah.
Unfortunately though.
So the bulletin board on the elevator that says free shoes, that would be exploitation, and they may or may not pick it up, right?
They might or may not, but
Yeah.
like I say, so if you call us to, like say, oh, I have a picture evidence of this, then we might or may not direct you to the HHS tip line, where you can
Great.
call them and see they take it.
Right.
But I can see what you're saying, because there's been cases when they are giving shoes for free in exchange of Medicare, which is really questionable.
Right.
Too. I've seen those.
And for other people, it really probably saves Medicare lots of money for not I mean, the number, it's like the fourth reason a person with diabetes goes to the hospital is a problem with their foot. Can't remember, it's ninth or fourth. Yeah, it's huge.
Yep.
That was my business. Yeah, for 40 years.
Dr. Brandley.
Yes, thank you, Mr. Enriquez.
Yeah.
Information that you presented was most interesting. Hello, everyone. Excuse me for entering late. Obviously work, but I'm always trying to be a part of this community because, as I said, the information is very, very helpful. I was looking at that slide that you had posted, and it was regarding the volunteer. I think that's what it was.
Oh yeah, let me go back.
See if I can go to it. It said volunteers can conduct outreach events, including health fairs and presentations.
Absolutely.
I'd like to maybe talk to you about that more.
Oh, yay.
Body Part Senior Fitness Foundation. We have conducted several health fairs, and as a profit, we're always trying to cut cost, but we have our mission where we say our service is nominal or free to our seniors, which is wellness programs. So that's what I would like to maybe follow up with you on later, just to get a little bit more information on how that actually works.
Here's my email down there. Do you see it?
The Marina?
No, Jesus Dad Enriquez. It's just in the chat box.
Oh, in the chat box. Okay, I'll go through it. Oh, I see it.
The
Okay.
only thing that we cannot do, though, because we have federal regulations, the only thing we cannot do is if somebody has a partnership with a health insurance plan, then we cannot partner. That's the only thing.
Can you repeat that a little louder?
If somebody is not partnered with, if somebody's partnered with a health insurance program or a plan, right? That could be a conflict of interest.
For example, what do you mean? For example, a health insurance program.
For example, if somebody has a program that is partnered with Blue Cross Blue Shield, for example.
Oh, okay.
Then we cannot, then we cannot have that volunteer. But if you get funding from other ways, then possibly yes. See what I'm saying?
Yeah, sort of. I mean, that just opened up more questions. I don't want to take everyone's time, but I do have your email, and I will.
Yeah, I'll go along with you. No,
Sure.
I'm
Thank
really excited though, because doctor in the city of Chicago, we have White-Crane Wellness Center. I don't know if that
Oh,
sounds
I've heard of
familiar.
them. Yeah,
Yep.
yeah. Great.
So Michael Speed is the director. So if everything goes well, then then you'll join her team. Their team, they have like 5 volunteers, but they always take more. They're always happy, always really happy. So
All
yeah,
right.
email me.
Yep, will do. Thank you.
Thank you. Yeah, no, you're muted.
I know, I'm sorry. Thank you, everyone.